subsequently passed. On the 28th of November, there was another birthday party in Tobago, which again spawned 5 cases. On the 8th of December, there was another birthday party in Tobago. So far, that has given us 1 positive case, but in speaking to Dr. Tiffany Hoyt just a few minutes ago, they are looking at all the primary contacts out of that case. So in 3 birthday parties in Tobago, from the 22nd of November, 28th of November, and 8th of December, we now have 11 cases with 1 death directly attributable to that birthday party. We have been advising the population not to have gatherings out of your immediate family. And on this Wednesday, if you remember, I had particularly reached out to Trinidadians going across to Tobago for Christmas not to let your guard down. The fact that you are on vacation does not mean that you could stop wearing masks, social distancing. You have to be as alert as you were in Trinidad. As Minister of Health of both Trinidad and Tobago, and the CMO is both the CMO for Trinidad and Tobago, we are concerned about what is happening in Tobago. We stand ready to support the Tobago Regional Health Authority. I will support my colleague, the Secretary of Health, Wellness and Family Services. The CMO will support his colleague, the County Medical Officer of Health, Dr. Tiffany Hoyt. But again, we are pleading with people both in Trinidad and Tobago not to have gatherings. We know now that 1 person has died because they went from Trinidad to a birthday party in Tobago. So that's the concerning news. There is some good news though. Over the last 21 days, there have only been 9 deaths in Trinidad and Tobago. That is good. That is good. And our last death has been on December the 2nd. We had told the population about 2 months ago that if we continued with daily case numbers of between 30 to 50, based on a case fatality ratio of 1.77, you would have 1 death per day or 1 or 2 deaths per day. As the total cases come down, so will the number of deaths. And could you imagine how good that is, that we are seeing a significant decline in deaths? It means less families are traumatized this Christmas, but some still are, but in smaller numbers. And that is to be celebrated, and I want to thank all 1.4 million people for cooperating with us. So we want to extend condolences to all those families, but also we could rejoice with those families who did not have a fatality as our cases come down. But we must extend our condolences to families. So that is where we are this morning. On the global scene, the numbers are still disturbing. Tobago is of particular concern for us. I have given you the dates of those birthday parties. I am again appealing to people not to congregate outside of your immediate setting. And even when you congregate and you invite 1 or 2 people home, please, as far as possible, wear your masks, social distance, keep your interactions as short as possible, so that what has occurred in Tobago on the 22nd of November, the 28th of November, and the 8th of December doesn't translate to a flooding of the healthcare system in Tobago, and then when you come back to Trinidad, you spread the virus to Trinidad. So that's my little update this morning, and I want to thank you this morning, Al, and I hand back over to you.
Thank you, Minister. We will move straight into the clinical update with Dr. Parasram.
Hi, good morning. Thanks, Al. Good morning to the Minister of Health, Dr. St. Bernard, members of the media, members of the viewing and listening public. So I'll first give the clinical update, and then I will go into a little bit of breakdown as to where our active cases are by way of comorbidities and other epidemiological features. So with regards to the COVID-19 update for December 11th, 4 p.m., the total persons tested so far, 38,252. Those from the private sector, 28,177 as of the 3rd of December, giving us a total of 66,429. Total positive cases now stand at 6,852 since the 12th of March. Total recovered patients, 6,103. Total active positive cases at 627. New positive cases reported in the last 24 hours are 19. Deaths remain at 122. Total hospital patients are 46. Those at our step-down facilities, 26. At the quarantine centers, 338. We are almost at maximum capacity in that regard. And total persons in home isolation are now at 536. By way of the Couva Hospital and Multi-Training Facility, we have 26 persons, 2 of those in ICU, 1 in high dependency unit. At the Cora Hospital, we have 2 persons left. At the Scarborough Regional Hospital at the Fort, we actually have 18 persons, which is a quite significant number, as Minister would have started the conversation about Tobago. So that accounts for 39% of the occupancy at hospitals at this point in time. With regards to our step down, Claxton Bay, 11, Day Bay, 7, and again Tobago, a high number of 8 for that island. And it is a worrying trend that we are seeing across the board. So if I can have my first slide, please. So again, starting with the highest proportion of cases by county, if you look at Victoria, 21.2%, followed by St. George East, 16.8%, St. George Central, 16.2%, and then closely thereafter, we have County Caroni, 15.8%, and Dr. St. Bernard will go into a lot more detail with regards to County Caroni in particular when she begins her conversation. Tobago, and again to highlight Tobago, 9.4%, is the 5th. Tobago normally accounts for anywhere between 1 and 2%, sometimes even less. We see that as a significant increase for Tobago. St. Patrick stands at 9.1%, St. Andrew, St. David, 5.1%, St. George West, which is doing very well at 4.7%, and Nariva Mayaro at 1.7% is the least. It has the least number of active cases in Trinidad and Tobago. Next slide. So again, patient distribution by sex. We have male to female, female with a slight preponderance, 51.4%, males at 48.6%. However, a figure that has been highlighted before, the number of deaths for males out are roughly 3 to 1 for males versus females. So 75% of the deaths we have had are for males, which is a significant deviation from this graph we're seeing male and female. Next slide. Patient distribution by age. So those are all the positives we had over the period of time. And we see the age distributions. Generally speaking, the largest two that we have are the 20 to 39 age group, 32.33%, and 40 to 59 age group, 29.32%. Less than 19 at 12.78%. And we have seen, as Dr. Paul would have indicated, 20 Miss-C presentations in the country so far, 4 of which have been positive and form part of this group. The latter group, 60 to 79, 24.44%, and a plus 80, there would have been 1.13% of the total positives. However, the latter group above 60 has given us approximately 80% of our fatalities thus far. Next slide. So home isolation, clinical case disposition. Majority of cases are asymptomatic at this time, 55.0%. Symptomatic are 25.6%. Transferred to facilities has gone up a little bit, 11.9% of the total average. Recoveries are at 7.5%. Next slide. So diabetes and hypertension seem to be the most the greatest number of comorbidities in terms of 28.9% for diabetes, 31.6%, hypertension, followed thereafter by heart disease at 3.9%, asthma 13.2%. Other illnesses 19.7%. Pregnancy is highlighted, not that it is a comorbidity, but it is a vulnerable state, as Minister would have pointed out to me last time. It is a vulnerable state. You are immunocompromised to some extent, and you have, with regards to respiratory diseases, for example, the influenza and COVID, you can have significantly varying outcomes based on the state of pregnancy. The last slide just gives you a total comorbidity at home isolated patients so far. So we have without comorbidities roughly 51.4%, and with comorbidities 48.6%, roughly half and half. So Al, that's my clinical update for this morning.
Thank you, CMO. Dr. St. Bernard will now provide us with an update on how County Caroni is managing COVID-19. She will also share some health tips to ensure that our children remain safe and healthy this Christmas. Dr. St. Bernard.
Hello and good morning, Trinidad and Tobago. Good morning, Minister. Good morning, Chief Medical Officer, Dr. Parasram. Good morning, Mr. Alexander, Senior Corporate Communications Officer. Good morning to the media, and good morning to the viewing and listening public. So I will be giving a brief update on the status of COVID-19 in County Caroni, and I would like to reiterate what the Chief Medical Officer has said, whereby on the first slide, what you will see are figures that show roughly half and half as well for the division by sex or gender. So on the left, you will see males contribute 53.2% to County Caroni cases, while on the right, 46.8% contribute to the cases for females. So it's kind of equal, but as the Chief Medical Officer has said before, this does not give us comfort in that, not because it's half and half, your chances of going into hospital or even dying from the disease would be equal. So we still need to continue to practice all measures to try our very best to not get COVID. On the next slide, what you're seeing here is the distribution by age, which is a little bit different to what the Chief Medical Officer would have just shown us. So interestingly, if you look at the highest bar, that represents the 20 to 39-year-old age group, and that represents 56.8% of the cases in County Caroni. So we do not have many cases in the elderly population. In fact, we have 0% in the over 80 age group, 9% in the 60 to 79-year age group, 27% in the 40 to 59 age group, and very few in the 0 to 19 age group, 6.8%. So the 20 to 39-year-olds, right? These are the persons contributing to most of the cases. And I will add, for County Caroni, we have seen a disturbing trend whereby prison officers have been contributing to not just the cases, but also to many contacts because of the eating, having, gatherings with no mask wearing. So that is just something to note. With regard to the fact that this slide shows so many in the 20 to 39 age group, I just wanted to mention that with regard to managing risk for young people, there are certain situations and activities that will increase the risk for transmission, and we need to avoid those. So we call those the 3 C's. We need to avoid the 3 C's young people. We need to avoid crowded spaces. We need to avoid close contact settings. And we need to avoid confined and enclosed spaces. And of course, if these 3 overlap, then your risk for contracting the disease is even higher. You can control if it is you come upon a situation where you realize you are being invited into a crowded space. I literally went to visit a facility once and they said, come, let's meet. And as I entered the room and I saw every chair occupied and the chairs were literally next to each other, and I stepped out and I said, we will not be meeting in here, we will be meeting outdoors. So you all need to, and by you all I would include myself, avoid the crowded spaces, close contact settings, and confined spaces. Moving on to the next slide, we're looking at now the home isolation patient's clinical disposition. So for County Caroni, most of our cases are actually asymptomatic, 45.7%, which is great. 34% are symptomatic, and we have 19 who have resolved symptoms and are close to discharge. In the other slide, if we look at the comorbidities, it's a little bit different to what the Chief Medical Officer would have shown us. County Caroni has The highest number of, the comorbidity number that is highest is belonging to asthma. We have 33.3% of our COVID cases having asthma. And that is of concern because of the implications if you have asthma and you also have COVID-19. 22% of the persons who are being managed have diabetes, 16% hypertension, and as we said before, pregnancy, which is not a comorbidity, but it does provide some risk. 11% of our patients with COVID-19 are pregnant, and then we have other at 16%. So if I could just mention with regard to asthma and the risk for severe illness for COVID-19, persons who have severe or moderate asthma may be at an increased risk for severe illness. So, of course, those with asthma need to be closely monitored, as we have been doing, whereby we call. And also they, as well as the others, have their pulse oximeters, so we are able to monitor via phone. If we move on to the next slide, you would see that in County Caroni, we have 66% of our COVID cases having comorbidities and only 34% not having comorbidities. So, of course, those with comorbidities are the ones that maybe then present for testing, more so than those without the comorbidities. But we have 66% presenting with diabetes, hypertension, asthma, and the other things that I would have mentioned before. So that is it for the County Caroni update with regard to the figures. So now I'm going to move on to how are we to protect our kids this Christmas. And of course, we know some of these things already, but yes, I'm here to say it one more time. We need to practice washing hands. We need to encourage our kids to wash hands. We need to practice cough and sneeze etiquette, covering our nose and mouth with tissue when sneezing and coughing, throwing the tissue in the garbage, washing hands after throwing it in the garbage. And with regard to children, very, very specifically, we need to look at the in-person playtime that our kids would want to be doing now that school is out. So the first thing is to limit as much as possible the in-person playtime. If we can encourage our kids to connect virtually and online with other children, that of course would be the best way to limit their exposure to COVID-19. But that being said, we do need to look at how can we manage playdates. So the lowest risk, of course, for a playdate would be the no in-person playdate, where kids connect via phone calls, WhatsApp video, Zoom. I mean, there are so many ways for kids to connect via the online platform. But, of course, while we're looking at the online interactions, we need to supervise our children when they do have these online interactions. Because, of course, we don't want to avoid one risk, which is in COVID, and then we introduce another risk for our children. So please do supervise the online interactions of your kids while allowing them to have their no in-person playdates or their online playdates, but ensure that we have no unwanted attention paid to our young loved ones via online games or online interactions. Medium risk playdates would involve infrequent playdates with the same family or friend who is also practicing everyday preventative measures. So Minister of Health was saying as much as possible, do not have outsiders. But if you do, it's just the one or two. Right? So we're not going to change our strategy. We were doing very well as a population before with regard to adhering, and we don't want to drop the ball now that it's Christmas and it's vacation time. So continue to also encourage social distancing if you do have the one or two kids coming over. And of course, as much as possible, have the playdates outdoors. That way, you have much better ventilation, right, compared to indoors. And guess what? They get to stay apart because they have the space to run and play. The highest risk, if we're going to have playdates for kids for COVID-19, would be to have frequent indoor playdates, multiple friends or families who have not been practicing everyday preventative measures, and of course allowing the kids to play very closely with one another. That would be very, very high risk. That would be not recommended. And with regard now to our kids not being unsupervised, we need to carefully consider who is the best person to provide childcare, since our children may not be able to be cared for by us. Postpone visits to the grandparents and the elderly relatives who are at increased risk for severe illness. So this now is us looking at protecting our loved ones from our children, in a sense. Again, use virtual connection to reduce risk of loneliness and isolation. So that please connect the kids with grandparents via the same online WhatsApp video, Zoom. Let them communicate, let them cook together, bake, show them wrapping gifts. Let there be connection, but not necessarily in person. Please do not take your kids shopping with you at the grocery and the malls if you can help it. Avoid running several errands whereby you are visiting several stores, groceries, hardware shops. Remember, the less interaction that your kids have with other people, the better for them. And also remember to wash your hands upon returning home. So when you have gone out and done all the errands and you've left the children at home, when you do return at home, please remove your face mask, put it to wash if it is one of those, put it in the garbage if it is a disposable, wash your hands, change your clothes before going to greet our young loved ones at home. So that is my message to you, Trinidad and Tobago, with regard to protecting our children during Christmas. Thank you.
Fantastic points, Dr. St. Bernard. Thank you very much. Next on the agenda is the question and answer segment, where members of the media are invited to pose questions to the panel. We now invite our first question from AZP News.
Hi, good morning. Prior Harry, AZPnews.com. My first question has to do with the thermal scanners. A lot of people now again are asking about whether it is okay to have this scan done on your forehead, whether there's any health concerns with that. First question. My second question is has to do with the COVID vaccine. When it comes, what is the policy with non-nationals, people like migrants, expats who work here, and diplomats? Thank you.
Okay, so you take the first one.
Okay. So thanks, Brian. So scanning on the forehead, there has been some research done which suggests that there's no health effects from that procedure. However, there can be alternate sites, for example, the use of the interior side of your wrist as an alternate site if persons wish to do so.
Yes, thank you, Prior. Prior, did you have your seasonal flu vaccine as yet?
Not yet.
Prior, oh God. All right. So thank you for that question about vaccines and who can get it. So, Cabinet note of June 2019, when I took the policy about the treatment of non-nationals to Cabinet, the Cabinet note, and I think I actually have it here. So let me read the actual thing. I actually walked with it here. Cabinet approved the policy for treating non-nationals with respect to the provision of public care healthcare services in Trinidad and Tobago. The provision of healthcare services within the public health sector for non-nationals residing in Trinidad and Tobago include emergency settings, and what you are asking about is vaccines, and it goes on like this. Population and public health services, including immunization and treatment of communicable diseases such as HIV/AIDS, sexually transmitted diseases, STDs, and other high-risk infectious diseases. So the giving of immunizations, the giving of vaccines is included under immunizations, and it will also be included under that catch-all phrase, other high-risk infectious diseases. So in other words, any human being in Trinidad and Tobago will be offered the vaccine free of charge, whether you're a citizen, a national, a CARICOM national, a migrant, a diplomat. Any human being in Trinidad and Tobago under this cabinet decision will receive the vaccine. So I hope that clarifies the issue. Prior, please go and get your flu vaccine, which I named after you, the seasonal flu vaccine.
Thank you, Minister. We now go to CL Communications. CL Communications, we're ready.
Good morning. I'm Natalie Singh from CL Communications. I just wanted to find out, would there be increased measures for Tobago, especially on the sea bridge and the air bridge, given that you have concern and deep worry because the numbers are increasing? And then are you continuing to see trends of people hesitant to go for flu vaccine or to be immunized? And then the 20 to 39-year-old bracket, are you concerned that the young people are not listening to the COVID-19 or adhering to the COVID-19 rules? Thank you.
Okay, so you asked 3 questions. The CMO will take 2, I will take 1.
Okay.
So I will take the issue on flu vaccines. So to date, we are in week 11. We have seen consistently over the past 4 weeks, the uptake is around 3,000, 3,001. To date, we have given out 50,137 flu vaccines. We had a discussion about this rate, and one of the issues we identified is that because there have been no deaths so far due to the flu, typically people rush for the vaccines when there's a headline in the newspaper or the 7 p.m. report on TV that 1 or 2 people have died. Because so far no one has died, our hospitalizations for flu have been relatively minimal. And before coming on air, I was speaking with Al. This is the first year I have not contracted any sniffles. It is mainly because we think, and the CMO could probably agree or disagree, of all the public health measures. People have on masks, they are social distances, they are washing their hands, that the rate of viral infections has come down significantly. So people are sort of dropping their guard as to the flu vaccine. But let me urge people, go and get your flu vaccine still. We want to end this flu season by around March of next year, because what we are trying to avoid is having the population receiving 2 vaccines at the same time, 1 for influenza, 1 for COVID. So, Nadaline, thank you for the question. Message to the population is, even though you are not getting the flu, even though you think you are well, please still go out, get your influenza vaccine. Let's get those numbers up. Thank you.
Okay, so I'll try to answer the question related to measures in Tobago in light of the increased movement between Trinidad and Tobago. So the first part of the preventative measures that we would take place, it is 1 country, 2 different islands. So we do have ferry service and we have air travel between both islands. So we have thermal scanner taking place, and that has been going on throughout. There is an increased vigilance by way of questionnaires, both on the air bridge and the sea bridge, to ensure that persons know the signs and symptoms when they come to Tobago. And of course, they avail themselves to the healthcare workers if they do have signs and symptoms, which is the most critical part of it. So if you have signs and symptoms, you get tested quickly, you won't go on to spread to anyone else. The other part of it is when you go from the airport and you go to your various hotels and guest houses. What we did is we, in collaboration with the Caribbean Public Health Agency, who had launched their Tourism and Health program on November 5th, is we reached out to them and they graciously acceded to our request and held a virtual seminar on Tuesday, the 1st of December, for Tobago only, training for Caribbean travelers' health stamp and assurance stamp for a healthier, safer tourism industry. So what it did is basically training members of that industry, the hospitality industry, to be aware of the signs and symptoms of the disease and to have a reporting framework so that if persons in their establishments develop signs and symptoms, they report it to the office of the CMO as well as the CMOH in Tobago as quickly as possible, so we can have our sampling done and then we can know if we are dealing with COVID-19 or something else. So that has been, the training has been done, and we hope that a lot of the larger, as well as some of the villas, will come on soon with regards to the assurance stamp from the Caribbean Public Health Agency, which will give us that added assurance that they will be able to pick up disease when it occurs in their premise and refer it back to us very quickly. So we're looking at securing the ports, yes, but I think more importantly is when people go across to Tobago to interact, and even in Trinidad when you go to hotels to stay, that if you have signs and symptoms, flu-like illness, that you let the persons at the hotel know very quickly so that we can know in health and we can do the sampling that is necessary. That's the best way that we can protect and of course quarantine and isolate yourself as quickly as you can. With regards to young persons, again, when you look at the epidemiological trend, yes, you're seeing in certain counties a greater proportion of persons, 20 to, let us say, 50, that are contracting it. But we have to see, because schools are closed, we expect that the largest population on the move at this point is the working population, which will more or less be persons between 20 and 59 in most instances. So they have a greater chance of contracting the disease. So not necessarily that they're not taking the precautions as other age groups are, but they are at greater risk just by virtue of being out of their homes for a greater length of time. So I wouldn't want to say that they're not following the public health measures, but across the board, of course, we're asking everybody to maintain the public health guidelines as we have put out and maintain the new normal as we go into Christmas season.
Let me just expand on what the CMO has said. And I want to thank you for the question, because the question is always, what is the government doing? What is the state doing? And I always say, the government can do all that it can, but it is up to the individual sense of personal responsibility when you reach Tobago. How do you conduct yourselves? Let me refer to those three parties. You know, those are those events, those situations where people's inhibitions drop. Because in a social setting, you haven't seen people for so long. We all suffering from COVID fatigue. We want an opportunity to let off some steam, to laugh, to hug people. We haven't seen Granny, we haven't seen Aja, Aji, we haven't seen Mousy, we haven't seen uncles, and so long. But now is the time in December where we have to maintain our personal vigilance. The state will do what it can, but I always ask people, work with the state and do what you can to help us keep these numbers down. Thank you very much.
Thank you, Minister. Thank you, CMO. We now go to CNC3.
Hi, good morning. Sani Gray from CNC3. I wanted to ask the Health Minister, given what you said about those infections in Tobago, and also we've been doing a lot of reporting on COVID parties and high-class weddings, do you think the public is, at this stage of the pandemic, the public is really getting the message of how we are supposed to behave right now? And specifically in relation to Tobago, you just said that people always asking what the government is doing. Has the Hotel Association in Tobago reached out to you to find out how they can be operating better with these increased flights to Tobago and increased numbers of Trinidadians going to Tobago for recreation? That's my first question. My second
that's
question
two.
is for one.
Go ahead.
Really quickly, I think this one is really important, and I don't deal with it enough. I just wanted to ask the CMO if you can give clear, direct instructions to persons who are suffering under the public health guidelines, who are having mental issues because of change of the new normal. Like practically, if I think I'm really not doing well mentally, what can I do to get help within the public health system? Thank you so much, and I appreciate your patience.
No problem. But I think you asked a very important question. Your first question is did the population get the message? And the answer is yes. And why? Because our 7-day rolling average started to decrease from 50s to 30s to 40s to 20s to teens. So the answer is yes. Our deaths have come down. The answer is yes. Most of the public has gotten the message, for which I am grateful. But there are still individual families, individuals, maybe one or two little communities, as we saw in Tobago. 3 birthday parties in Tobago. Well, let's focus on 2. 2 birthday parties, 10 cases. 1 birthday party, 1 case so far. It is those pockets of people who have not gotten the message. So by and large, the numbers tell us the numbers of deaths, which have come down, the 7-day rolling average, which is now in late teens, that has come down significantly. So the gross numbers tell us most of the population has gotten a message. But there are still pockets of people that still insist on having birthday parties, zesta parties, and it doesn't matter what socio-economic group you belong to. We need everyone to get the message. And that one death that came out of a party in Tobago, that when the person came back to Trinidad, is regrettable, which could have been avoided. So on the issue of Tobago hotels, we set out guidelines for every single industry, correct, CMO? We didn't set out one set of guidelines for Tobago hotels and one for Trinidad hotels. We sent out guidelines for the whole hotel and hospitality industry. So that went out, and then the CMO could talk a little more about the mental issue.
Yeah, so I mean, you asked about the Hotel Association. The Hotel Association has been in constant communication with both the CMOH in Tobago as well as the Caribbean Public Health Agency and the Ministry of Health throughout the whole process of the rollout and formulation of the THP program. So they have been part and parcel of it from the start. They were part of the launch on November 5th as well. With regards to mental health issues, it's a very wide spectrum of disease. We would have had Dr. Otello going into significant detail as to what to look out for in terms of signs and symptoms for different illnesses, depression, anxiety, and all those different illnesses. But the key to it is once you find yourself exhibiting those symptoms that she would have said, lethargy, unusual symptoms of sadness, sometimes it can be just feeling not completely as yourself, you should reach out for help through one of our regional health authority centers, some of the health centers, or your private practitioners, to at least get an assessment to see if, based on their clinical assessment and their clinical judgment, if the symptoms are within your normal spectrum for emotional behavior, or if it is deviating into some one of the other diseases, for example, depression or anxiety or anything else. So I think the key is just knowing having a track of your signs and symptoms, knowing your mood in general circumstances, and of course, if you have significant deviation, to seek medical attention as quickly as you can. Other agencies, for example, Social Development has, for persons that have gone into significant levels of depression, set up suicide hotlines, which are available on the various websites as well.
Thank you, CMO. We'll now take 2 brief questions from the Newsday.
Hi, good morning. This is Janelle D'Souza from Newsday. First off, can I know you mentioned the children before who have had COVID. Can you get a general idea of their health status? Are they improving, that kind of thing? And the second thing is vaccines. The Prime Minister has told us that we have more than 400,000 vaccines have been pre-ordered. Have we received any updates on the rollout? And even as the UK and the US have had vaccine approvals for emergency use, have you all gotten any information that the general public hasn't had about maybe side effects or anything like that?
Okay, so I will take the second question first on vaccines, and then the CMO will talk about his part. So, as I mentioned on Wednesday, and it needs repeating, so thank you for asking. Under the COVAX facility, we will be receiving vaccines approved by the World Health Organization. To date, Saturday, the 12th of December, there is no vaccine approved by WHO. What has happened is that the Pfizer vaccine has been approved by the US FDA and going through an approval process for what is called emergency use authorization for the United States. The UK had a similar position, and I think Canada has a similar position. We have not received any word as yet from WHO or PAHO that any vaccine has been approved under the COVAX facility. The side effect you were speaking about, and we need to talk about side effects, realistically. all drugs have side effects. I could probably ask Dr. St. Bernard to talk about the side effects of aspirin in children, which is potentially life-threatening. What I would like the public to know from a policy perspective is that we must not overreact when we hear about side effects because of the heightened news coverage about vaccines. Every single drug has side effects, from aspirin to paracetamol, could damage your liver. But because of the heightened concern about vaccines, I don't want the public to zero in on the one or two reported side effects and lose sight of the good that vaccines do. So, the two side effects noticed in the Pfizer vaccine in the UK, that was noticed in 2 people who have known allergies and who walk around with their EpiPens. An EpiPen delivers a dose of adrenaline, is it adrenaline?
Yeah.
To people who have hyperactive immunity systems. So those are known persons. So the general advice for any medicine, when you go to a doctor's office and he wants to give you a shot of penicillin, the first thing he asks you is what? Are you allergic to penicillin? So let us contextualize those 2 so far rare side effects in the context that all drugs, penicillin, and I'm going to ask Dr. St. Bernard to talk about what could happen with a child taking aspirin. So that is what has happened so far. Let's contextualize those 2. Okay? Thank you very much.
Okay. So with regards to the update on children, so we have 3 children in hospital at this point, all in Couva, at the Couva facility. 2 of them would have had what we described as the MIS-C presentation. Another one would have had an immunocompromised state before. So they all have been at ward level now. So they're not in ICU, they're not in HDU, they're very stable. So that's the update basically for the three cases that remain in hospital.
Right. Dr. St. Bernard, could you just talk briefly about aspirin sensitivity in children so we could contextualize this thing about side effects of vaccines?
Hi, thank you for the question. So with regard to side effects from aspirin in children, there are common side effects and then there are rare side effects. Common side effects in children will include things like heartburn, you know, where you get that burning in the middle of the chest, irritation of the stomach, nausea, so they can feel to throw up with aspirin, stomach cramps, and even vomiting. So these are the more common side effects that a child can have when they have ingested aspirin. But we have rare side effects that sound a lot more dramatic. So we can have a decrease in their clotting, which means the increase of bleeding, the chances of bleeding from the gums, from getting a cut. They can have a rupture of the wall of the intestine, so they end up bleeding on the inside. They can have a significant reaction, which we call anaphylaxis, where they literally will have problems breathing and need that same EpiPen injection that Minister was speaking of earlier. They can have anemia, they can have bleeding, blistering of the skin, they can have their airway closing down, which we call bronchospasm, hives where they break out in big bumps all over the skin, seizures, your white cells can go down. I mean, the list actually can go on and on. You can have wheezing, trouble breathing, ulcers. So there are many things that can happen when a child ingests aspirin, as simple as aspirin sounds. So I don't know if this would help. I think this helps the question that Minister has posed with regard to the ingestion of aspirin in children. Thank you.
Because this is part of the education of the public about when we start to roll out the vaccine, we must be realistic that all drugs have side effects. What you don't want is the 1 in a million side effect to then discourage 999,999 people from receiving the vaccine to save their lives. All drugs, from the simple aspirin, penicillin can kill you if you are allergic to it. Paracetamol can mash up your liver. All drugs have side effects. I just want to contextualize that as we start to have a serious discussion about vaccines and side effects.
Thank you, Minister. We now go to the Express.
Good morning.
Good morning.
Can you hear me?
Yes,
Yes.
Please pose your question.
Oh, yeah. Minister, I'd like to ask, if it is that we continue to see the upward trend in cases in Tobago, would we revert to the restriction of movement between both islands? And secondly, the one person who died after attending that birthday party, what age category did that person fall into?
Okay, thank you. So the person who died coming back from Tobago was an elderly person with comorbidities. It wasn't a young person. To answer your first question, we must do all that we can to keep levels of this virus down so that the economy stays open. We are nowhere near a heightened stage of concern, but we are worried that persons are still not adhering to the simple advice not to congregate. If we limit our congregation, the length of time we are congregating for, avoid situations where we cannot keep on masks, avoid situations where we cannot social distance, what you may find happening is that the Tobago health system may become compromised. And then people, Trinidadians, may come back to Trinidad and compromise our healthcare system. The healthcare system, at my level, we had set a target of 20%. That is, our hospitals treating COVID should not be more than 20% filled, either at the ambulatory level, the HCU, or HDU level. We have maintained that brilliantly for the past month and a half. We have been between 15 to 18%. So we could treat a lot more cases without shutting down the country. And that should be our goal as a country. Because it is not an option to shut down the country again. It damages economic activity, loss of jobs. That should not be even in the discussion. The discussion has to be personal responsibility, heeding the public health advice, and we are all our brother's keeper in this. Thank you very much.
Thank you, Minister. We'll take a quick question from AZP News.
Hi, morning again. Minister, just to clarify, the immunization policy, it is for all vaccines, be COVID-19 or be influenza, right? I don't want to clarify that. But my main question now is the COVID-19 vaccine, the COVAX facility is for the public sector. What happens if the private sector wants to bring in some vaccine with COVID-19 for COVID-19? And I ask that in the context of the influenza vaccine. Remember, there were issues with the quadrivalent and trivalent. Is there any strict monitoring policies by the ministry in case the private sector would like to bring in any of the COVID-19 vaccines?
It has to be registered.
Yeah, thank you. So let me just reiterate, our immunization policy applies to any human being in Trinidad and Tobago. That's a cabinet decision. It applies to polio, it applies to tetanus, hepatitis, influenza, COVID, yellow fever. So I hope that clears up that. Any private entity, once a drug or a vaccine is registered, they are allowed to bring it in. So if any vaccine maker has a local agent for a vaccine and that local agent wants to bring it in, they apply for registration in the normal process of registering any drug. Once it is registered, they are free to bring it in, as they do now.
If I may add, prior, so in terms of the registration process, we will ensure at the Ministry of Health that there is safety and efficacy, and what we usually look for as well is that particular drug or vaccine is also registered in an international agency that has stringent regulatory authority as well. For example, the EU, US, Canada, those institutions as well. All right.
Thank you, CMO and Minister. We go to TV6.
Sure.
Hello.
Hi, morning.
Renessa.
Morning, Renessa.
Hi. Could the Ministry give an update on the legislative framework that will enable the task force to go into private property and enforce the regulations? And also, I noted that Dr. Bernard mentioned an incidence of COVID cases among prison officers in her county. Could the Ministry at this time state how many prison officers are among the active cases in the country?
Okay.
Prison officers and prisoners. Sorry.
Thank you. So the first part of the question, the Attorney General hasn't gotten back to me as yet. If you follow the Parliament channel, the Attorney General was in the Parliament Tuesday, Wednesday, Thursday, Friday, 4 days of this week, piloting bills in both chambers, and many of these sessions went into the wee hours of the morning. So I'll talk to him maybe tomorrow and see if he has any update for me on that. But again, don't wait for a legislative solution to do the right thing. Personal responsibility this Christmas. Limit your gatherings. Don't throw big parties. Don't have Zessa parties. There was a party down the islands 2 weeks ago. We know about it, the same way we know about these 3 parties in Tobago. Every socio-economic group has to band together for the next 2 weeks. It's just 2 weeks to have a quiet, holy Christmas. Whether you are tempted to party down the islands, in Tobago, in a warehouse in Caroni, in a wedding in Valsine, these big gatherings for the next 2 weeks, we are asking people, for the sake of our children and our elderly, please, just do the right thing. One of our watchwords is discipline. Let's be disciplined for the next 2 weeks.
So Dr. St. Bernard, you wanted to elaborate on the county, on the prison officers in Caroni?
Hi, thank you for the question. I actually don't have the final number right now. I was trying to get it as the question came. I knew I had heard about 5 yesterday, but if I get clarification, I will answer. Thanks.
Thank you, Dr. St. Bernard. I now hand you over to the Honorable Minister, who will close.
Thank you very much, Al. I normally don't make a closing statement, but I think as we go into Christmas and all the exhortations from the Honorable Prime Minister come down, myself, the Archbishop, who is asking his flock, I again ask all members of society, let us learn from 2 experiences. One, the experience in Tobago. And if you would remember, I did play a video clip on Wednesday about a family gathering in the United States. Now that we have concrete proof of what happened in Tobago, that video clip seems so prophetic. And I think it is something we could all learn from. And I will just close by playing that video clip again. It was prophetic. We don't want people to die, as that elderly person did by going across to Tobago. So I'm going to ask the video clip that was queued to be played, and this will be my closing comment via that public service announcement.
With Thanksgiving 2 days away, one family in Texas wants to spare you from what they call the guilt of gathering. 15 members of the Aragonés family contracted coronavirus after getting together to celebrate a birthday on November 1st. After months of staying at home and wearing masks, and they tell their story in a public service announcement from the city of Arlington.
2 weeks ago, I had family over.